It's almost disheartening how ridiculous and stupid our quacks are, that they will just lie straight, bold face, and then put this air of authority, this pompous, stupid attitude that they're so superior when they lack critical thinking skills, common sense, second grade arithmetic skills. Like, I'm literally gonna tear this guy a new asshole, and you're gonna watch it on video. So let's make fun of this guy. This is Dr. Rough and not so smart. So we're gonna look at this guy and just view some of the comments this quack says. It's absolute nonsense. You said there's no cause where circumcision was medically necessary. I know of at least one such case. So your argument is flawed as it relies on a false statement. When debating, only use true statements. The incidents of you actually meeting some guy that was actually needed a circumcision are so rare that I could say that easily with no qualms. Yes, there are medical examples in history where a man needed a prepuce amputation. There was a guy who hooked up a kite in a lightning storm using a metal rod to his penis, and he actually needed a prepuce amputation. That's like the only time in human history. Okay, I'm making a joke about it, but it's just so utterly ridiculous. I mean, I've talked to 30-year medical or veterinarians who have never in their entire medical career, and these are literal doctors, medical surgeons, who have never ever once heard of another animal needing a prepuce amputation. There's 5,488 mammal species who all have this tissue. Yet doctors who, medical doctors, they have one species, right? One. And we think they're smart. Okay, veterinarians, that's every other species, okay? Every other species is literally their doctors for every other species. They have to know all of the species. So for these quack doctors to say he knows somebody that needs this, I can utterly know that he's full of shit right off the bat. I mean, we're going to get into this because the funny thing is this quack actually knows like some of the most extreme needs for but he should know. I mean, this should be basic knowledge for quacks, but what he doesn't know will blow your mind. It's absolutely ridiculous, this guy. So, phimosis is the most common reason for a adult would get a circumcision. Yet in most cases, non-surgical treatments exist. Can you see the gall just oozing off this guy? Just this air of authority, this pompous attitude, this little twit who thinks he's so intelligent. You will, first off, phimosis is literally caused by these medical quacks not knowing how to do their job. Okay, the large majority of phimosis cases are caused by doctors force retracting or doing what's called premature force retraction. This is well known. Robertson's neonatology, Avery's neonatology talks about this. Robertson's neonatology talks about this. This up real quick. I wanted to read something to you so you can see that I'm not the one who doesn't have any knowledge of what they're talking about. This guy is literally doesn't know what causes phimosis, why it happens, or how to fix it. So let's review how phimosis happens. So this guy we're actually having a discussion of his friend who had phimosis and supposedly had or needed to get circumcised. That was his only option, which is total bogus. Gardner's error concerns the erroneous notion popularized by British pediatrician Douglas Gardner in 1949 that an intact boy's foreskin should be fully retractable by age 2 to 3. Gardner was grossly in error, as Europeans and better educated American physicians know. Almost none of them know. Modern research, multiple times since 1968, shows that the actual mean age for natural, normal, expected, non-traumatic foreskin retraction is 10 plus years, and even puberty is no indication of pathology. Avery's neonatology. Forcible retraction of the foreskin tends to produce tears in the prepubital orifice, resulting in scarring that may lead to pathogenic, i.e. in this case, iatrogenic or physician-induced phimosis. Robert's textbooks of neonatology. Forcible retraction in infancy tears the tissues of the tip of the foreskin, causing scarring, and this is the commonest cause of genuine phimosis later in life. To appreciate the scale of the error, consider its equivalent in women. It would be as if doctors had decided that intact hymen in infant girls was a congenital defect known as imperfect hymen, arising from arrested development, and hence needed to be artificially broken in order to allow the interior of the vagina to be washed out regularly to ensure hygiene. Robert Darby, A Surgical Temptation. There's actual books and stuff on this. And then you've got literally a solution right here called FemoCure. Let's open this link. It's a solution to this problem, right? Complete solution to the problem. So there is no reason for this guy's friend that he knows to be mutilated. There wasn't one. He could have used FemoCure. There was a survey done by Intact America, and out of the respondents, 43% of the respondents had been force retracted as babies. Now, imagine if 43% of Intact American men were force retracted as babies. That's a huge number. This is where you get this, I needed to be circumcised as adult garbage. Because first off, it's garbage. Second off, it's caused by the doctors in the first place. And this is why it's garbage, because you can completely treat and 100% treat this. Now, will 100% of people treat this? No. But can 100% of people treat this? Yes. And let me explain that. Because you have this process called mitosis, which is cellular reproduction. And this happens in the skin. This is how you grow. If your skin didn't grow, if you didn't have the ability to mitosis, you would literally pop at the seams because your skin would not grow. So there is no living human alive who doesn't have skin mitosis. In fact, there are men with the most dramatic circumcisions possible who have completely re-stretched out and regrown their entire foreskin and now have their glands completely covered when flaccid. A lot of these men have completely covered their glands when flaccid. And this is from nothing, right? So this is starting at nothing. So if you have phimosis caused by quacks force retracting you as a baby, which causes scarring, leading to phimosis, then all you need to do is stretch it out and keep stretching, and eventually it will regrow itself. Because that's what it does. Because you stretch the skin. If it didn't, you wouldn't be alive. Does that make sense? So there's no situation or scenario in living organisms where mitosis of the skin just doesn't work. That just doesn't happen. So the men that don't do it, that don't cure their phimosis with gentle tugging and traction, they're lazy. Okay, they are a very, very small percentage of men that they're just too lazy to do it, and that's okay. Okay, if you're too lazy to prevent the surgical removal of the most pleasurable part of your body, the main sensory tissue of your genitals, then go at it, bro. I don't care. But for you to say that you couldn't do it, that your skin doesn't grow, that mitosis doesn't work, is a straight up lie. Right? It's a straight up lie. Okay? So this guy, he pretends he knows it. For surgical treatment, circumcision is recommended simply because of how effective it is. Yeah, it will completely stop phimosis immediately if you're lazy and you don't care about sexual experience, which I can guarantee you there's not very many on the planet who don't care about their sexual experience. Unless they don't have any. You know, anyways. So yeah. So, there's prepuce and the dorsal slits as alternative surgical treatment. However, both of these have higher chances of phimosis from reoccurring. That's why you do stretching with FemoCure.net for $33, doctor, and you can cure 100% of phimosis unless it is caused by BXO or Balanitis exotica obliterans. Excuse me. Which circumcision is almost 100% curative treatment. How is that, doctor? What if your BXO is on your gland, is further down your shaft? Do you have to take that off? What about if it's on your glands? So how can it be 100% curative? BXO can occur anywhere in the skin. So it can't be 100% curative. So, wow, doesn't make any sense what you just said, but yeah, let's keep going there. Check this out. Because of the research that Good Quacktard stimulated, I learned something new. I learned that BXO, the literally almost only legit reason to mutilate the genitals of little children, like the only actual legit medical reason that's actually gonna ever happen. It's extremely rare. Its rough estimates are in 0.1 to 0.3% of males overall. So that's a very small number of men. And in men with phimosis, this is where I just learned, BXO shows up in above 10 to 40% of those cases. And that BXO can be caused by irritation or autoimmune disease, but they don't really actually know what causes it. Literally, the quack's lack of knowledge is causing BXO. The almost only legitimate reason. I mean, a massive increase from 0.1% to 0.3% to 10 to 40% of those cases. Wow, I did not know that. I knew that phimosis, that quack caused phimosis because they force retraction. This phimosis causes an increase in penile cancers because hygienic problems is the main cause of penile cancer, lack of hygiene. Well, if you can't retract, it's harder to clean out. So the quacks are causing not only the cancer, they're causing the BXO, they're causing the phimosis, they're causing all of it. Their lack of knowledge, the complete lack of knowledge is causing all of these men that you hear about that have to get circumcised later in life. This is, wow. I mean, you learn something new every day. Thanks, doctor. Ironically, labiaplasty is another medical operation that does indeed have cases that make them medically necessary. Like in the case of BXO, which is 6 times more common in females. So you're 6 times more likely to meet a woman who had BXO required labiaplasty than you are ever to meet a man who had BXO required prepupetoplasty, or removal of the prepuce. This is hilarious. Now here's where we get to the quackery, because let's just admit it. Anatomy is not up for debate. Like, if you don't like the idea that pinky fingers exist, you're not liking that idea isn't gonna change it. If somehow you need an opposing thumb but you don't have one, you not wishing that opposing thumbs didn't have a certain function is not going to change the fact that you're missing your opposing thumb, right? So if you're lacking the main sensory function tissue of your genitalia and it's no longer there, then those nerves are not sending signals to your brain. So let's say you have a person that they have a very minute circumcision and it removes exactly one nerve from their genital tissue. Well, they have exactly one nerve less experience than they would have had the quack not done their microcircumcision. Makes sense? So if you cut off 2 nerves, then you have 2 lacking nerves. If you cut off 3, that's 3. If you cut off 4, that's 4. If you cut off 10,000, then you no longer have 10,000 of those nerves. Now, so the quacks don't get all up in their panties up in their uppity bunch and get their English accent in a bunch. Yes, we have never actually done a study to determine the microdensity of nerves in the human prepuce. And that is a fact, but the only people that have ever done a microscopic examination, Taylor, Cold, and Lockwood, estimated between 10,000 to 60,000 nerve endings. in total in the prepuce. Those are the only people who actually took a microscope and looked at it and did a histology study of it. Okay? So, any removal at all of any sensory tissue is therefore a reduction in that sensory tissue. And if the prepuce has a lot of those nerves, and it has estimations between the best anatomists in the world that have studied it, about 75% of the total nerve endings. So you're talking about a 75% reduction in the sexual experience and pleasure of the experience. Because those nerves are not there to communicate to the brain. Therefore, the signal does not go to the brain. I mean, how utterly ridiculous do you have to be? And this guy, he's quoting Brian Morris again. We all know Brian Morris, the circumfetish pedophile, who has literally been caught on fetish websites. And has lied for an entire career, publishing nonsense, ridiculous pseudoscience lies all over PubMed, just making ridiculous claims. He's an absolute quack. And this guy is quoting Brian Morris, of course, that there's been no signs of any reduction in any of the sensory experience because I really like it when kids scream under my knife. His urologist required him to do 8 weeks of foreskin stretching. There was no significant improvement. So his urologist was not confident he would see improvements in another 2 months. Yeah, this guy can't get fatter anymore. If he does, he's going to literally explode. So, this guy needs to go on a severe diet because if he grows any skin at all, his skin will crack and he's going to explode because his skin doesn't grow. Do you guys catch that? His skin doesn't grow. Yeah. I'm sure, buddy. And his urologist made less than $300 on his surgery. He didn't make the normal $3,000 to $5,000 on this unnecessary male mutilation by quacks with not giving proper informed consent, because the quacks can't give you proper informed consent because they don't even know the structure and function, because they say that removing the main sensory tissue has no effect on function because, I don't know, maybe Dr. Rough in the Brain, I would actually call him Smooth, Dr. Smooth Brain. Dr. Smooth Brain thinks that removing 75% has no effect on experience. No good evidence that... this is like saying that if I gouged out my eyeball, there's no good evidence that I've affected my eyesight. Or if I cut off my tongue, there's no good evidence that I would affect my lunch at all. That if I fucking cut off my hands, I would have no effect on I don't know, creating origami. It's just so utterly ridiculous. Like, this is a medical doctor, a doctor, a quack of the highest level. I have to say the stupidest things to even overcome his logic. It's like I have to go to the basic fundamentals. Hey, you kicked in the nuts. That's sensory tissue. That's sensitive. That hurts because it's sensitive. So if you cut that area, it's going to be sensitive. Painful nerves. Sensitive. Cut away nerves. Less sensory tissue. Less sensory tissue. Less input into the brain. We're talking second fucking grade math. It says female cure doesn't even say it's 100% effective at treating of phimosis, because you got the 1% who's just too lazy to actually do anything. And this guy that stretched it, did he really stretch it? Did he really use the creams? Did he really use the steroid hormones? Did he really? Yes, but all these men all over the world are restoring 100% their foreskin from nothing. But this guy can't get a couple millimeters, can he? Absolute quackery. Absolute nonsense. I got to the point I'm not even going to reply to this guy. I just made the video. I'm going to just reply with the video because it's so dumb going back and forth. I can't prove. If you don't know 4 minus 2 equals 2, like that, the agreed upon message and when you do subtraction, that these things have value and meanings, and that they actually have real world application. If you have 4 apples and you eat 2, you have 2 left. You know what I mean? Like, and if he's like, no, it's 4. Like, what do you say after that? Like, can I break it down into in a more basic level? I can't really. Like, where do I go? I mean, when you're underneath the level of 2nd grade math, right? Like, when you can't go any lower than that, what else do you say? You make a video about it, I guess. But I mean, it's just, show me meta-analysis that shows scoping eyes has no impact. I mean, it's just so stupid. Like, there is no meta-analysis that scooping out your eyes has any impact on eyesight, because it would be self-evident, right? You don't need a study. There's no one's going to commission a study that's going to go show. I mean, it's just so stupid. I mean, it's just so, it's boring. And yet the irrefutable truth on the impact of circumcision for sexual performance, sensitivity, and pleasure. So no significant changes. So while it may be true that the foreskin has a lot of nerves, the real humans that get the procedure seem to not notice a difference. Almost as if it doesn't matter. If they have a lot of nerves, it's not the main component for sexual pleasure, as all the nerves says that's the glands, as all the research says that's the glands. I mean, all the research that you haven't read, you've never read the histology study of Taylor, Coulter, and Lockwood, which shows that the Meissner corpuscles are found in the ridge band and the frenulum. You've never read the neurological testing of Dr. Sorrells, who found that the most sensitive part was in the frenulum and the ridge band, which matched the Meissner corpuscles that were found in the histology study. And also that the glands is the least sensitive to fine touch sensation, the least sensitive. It's not the most, it's the least. What the men are feeling is the nociceptors, because they're mutilated. And so the nociceptors in the glands is exposed. So the nociceptors become more sensitive. They become more hair trigger. That's why circumcised men have higher rates of erectile dysfunction and premature ejaculation. So they have the erectile dysfunction later in life because they've lost all the nerves. Lost nerves, no sensation, and what's left is dulled because it's supposed to be protected. It's mucosal surface. It's not supposed to be exposed to the outside. So it becomes more dull, and it creates this veneer-like scar tissue on the surface, which is this thicker tissue that men who regrow their foreskin say sloughs off after they've restored their foreskin. So this quack has no education in any of this stuff. Yet here he is saying that there's no effect on performance, sensitivity, or pleasure. You know how many men I've talked to that have had this done as adults say it's the worst thing they've ever done? And every man that you will ever talk to had full function will say the same thing. And that these men that are saying that they have improved function are in fact victims of forced retraction and iatrogenically caused phimosis. Iatrogenic means doctor-caused phimosis. So that's why these men say it's better, because they had phimosis. Their tissue never everted. And this tissue everts, becoming the main interfacing tissue that both gives and receives. It is literally the part that transfers the sensation. To say it doesn't have sensory input is absolute nonsense. I mean, I can't say anything other than 2nd grade math. You know, there is no further. It's rods and cones of the penis when you move it, see a dramatic. Yeah, people have gotten even notice do not even notice a significant change. How many men have you known that have done this as adults? Quack. How many men have you known that had full function that did this as adults? None, because the men with full function don't do this. And the ones that do it with full function, they become intactivists like Nico Kouturas, who says that he lost 80%. And I've talked to numerous men just like this. 80%, it's very significant. And this quack, I mean, I don't have any time to just continue to just berate this ridiculous quack. I mean, you see how nonsense this is. Dr. Smoothbrain, you're not rough, brother. Rough is not what's going on. Wow, this guy is one of the most ridiculous quacks I've ever seen. Yeah, see, the men have gotten circumcision disagree with its impact. If you just keep lying, it's so sad. I mean, I've talked to hundreds Hundreds of men. I've done this for 14 years, quack. I know more about this than you and every colleague you've ever met in your entire life. Every doctor you sat in front of in a lecture hall. Every quack you've ever shooken hands with at some event. Oh my God, it's just so fucking stupid. I mean, he repeats the same shit. Like, he has no really... I mean, when I first started with this argument with this guy, he's I know a guy. That was his argument. I know a guy. I thought he was like not even a real doctor at first. He was like, I know a guy. I'm like, that's your argument? You know a guy. I know a guy that had one medically necessary. You know a guy. You know a guy that had one medically necessary. So yeah, you're wrong. You said I never met a guy that had one medically necessary. I was like, you know a guy who was lied to by a quack into a mutilation and a self-mutilation. That's what you know. You don't know a guy that had a medically necessary circumcision. And then he goes on to tell me, oh, he had phimosis. I mean, you saw it. So no, you did not know a guy. You do not know a guy who had a medically necessary prepuce amputation. You met a lazy guy who did a half-ass attempt at whatever and had a shitty urologist who doesn't know the anatomy, structure, and function. He's cutting off men and doesn't know the part he's operating on because he's a quack like you. Because if he told this guy, hey, brother, the ridge band's there, the frenulum's there, they're full of Meissner corpuscles. All you have to do is stretch this out for a little bit longer, buddy. We'll give you the creams. We'll give you the stretching. Come on, you can do this. We got your back. Be a man. Take care of this. We know you got, force retracted as a baby. Sorry about that. Sorry that quacks like me are so uneducated. We caused your phimosis. Sorry about that. My bad. Let's fix this. No, instead, you say, you know what? I can make $300 off this guy in 15 minutes. What an idiot. Oh, okay. Yeah, it didn't work. Oh, too bad for you. Let's cut that shit off, bruh. Let's get that shit circumcised. Let me make a little bit more money. I like doing it. Makes me hard inside. Yeah, they really want to do it. They really have an obsession with doing it. They get off on it. It's a really weird thing. But these people are obsessed with this. You see how this is not a normal... If this was a normal medical condition, this quack would not be searching all over the internet, reaching and grasping for stupid excuses, denying anatomy, like literally denying the actual human anatomy that 70% of the world's living men can prove right now. Go jerk them off. They'll tell you that's where it feels good. If you cut that off, it's not there to feel good anymore. That's common sense. And I've talked to way more men than you, doctor, about this issue. Way more. Promise you that. You're embarrassing yourself. You're embarrassing the medical profession. You're an embarrassment to America that we have quacks and idiots like you given this high accolades and called doctor with your pompous attitude and your just mind-boggling lack of reality. I mean, you are so delusional. You are suffering trauma anatomy denial. You were so damaged by your circumcision, doctor, that you have never recovered mentally, and you literally cannot handle facts of human anatomy. I see this all the time. Men who can't handle anatomical facts. There is no way on this freaking planet that removing one nerve doesn't reduce the input by one nerve's input. That's math, right? There's no in between. There's no secondary consideration. There's no what if. There's no imaginary number. There's no I hidden in the mix. You know what I'm saying? There's no quadratic equation you have to pull out. There's no calculus in the system. It's pure, straight, second grade arithmetic. And these quacks will lie through their teeth. He lied about knowing somebody that needed it. No, you didn't know somebody who needed it. And I proved you didn't. And he'll lie about the anatomy, structure, and function. He'll lie about it, how it influences everything. And I gave him the histology. I gave him the neurology. He just literally denied anatomy, structure, and function that was given to him. Not by me. I didn't make this shit up. I didn't do the histology study. I didn't run the electron microscopes on the slices of tissue. Okay? Histologists did that. Like literal scientists. Okay? I'm not the one that did the Semi-Wiseman's monofilament fine touch fiber testing on 360 men or whatever it was. Mapping out fine touch sensory testing. Find that they actually match the histology studies. And if you don't know the histology and you don't know the neurology, you have no clue about the anatomy, structure, and function you are talking about. None. And you're sitting there bragging about how you know a guy that had to have it done. You're an embarrassment, doctor. You're an embarrassment. And you're not even worth this. But you know what? Because you're so embarrassing, I had to make a video to just show the world how stupid you are. And I got images on this video that will literally debunk you. So you're sad, you're pathetic, you're a liar, and you're a quack, and you're hurting children. And your profession is a sick, disgusting, barbaric, psychopathic, money-hungry, greedy quack profession full of quacks. I'm sorry, I get a little bit upset about this. These people are sick, and they shouldn't be allowed near children. This quack should be in a prison somewhere, rotting somewhere for lying, because his lies hurt children. These quacks' lies hurt children. They kill children, and they get away with it. And I will never stop exposing these quacks. Never.